Today we are going to unpack a study that is, well, it's a real game changer. It gives us this powerful, practical, and honestly, just a really elegant way to reframe those lifestyle conversations we have with our patients every single day.
Welcome back to the Physio Roundtable. You know the lifestyle talk, we all do. But what if we can make it simpler, more achievable for our patients? And what if it was all backed by some of the most solid data we've seen in years? Well, that's exactly what we're digging into today. So let's just start with a really big question, one that gets right to the heart of what we do as clinicians. We're all part of a system that's helping people live longer lives, for sure. But are we helping them live healthier lives for longer? You know, there's a huge difference. And that gap between living and living well, it's getting wider. And that difference, it really comes down to these two terms, lifespan and health span. Lifespan, that's the easy one. It's the total number of candles on the birthday cake. But health span, that's the number of years you get to live well, free from the burden of major chronic diseases like heart disease, cancer, or type 2 diabetes. And that second number, that's the one where we can really truly make an impact. Okay, so here's our game plan. First, we're going to look at just how big this health span problem is. Then we'll introduce the 3 pillars of a new framework called SPAN. After that, we'll get into the really cool part, the incredible power of their synergy. We'll find out the absolute minimum dose for the maximum effect. And of course, the most important part, what does all this mean for you, in your practice, with your patients?
So let's start with the challenge we're all up against. You see it every day. Medical science has been amazing at pushing lifespans up, but our health spans, they are seriously lagging behind. People are spending a much bigger chunk of their lives just managing illness.
And this isn't some small issue on the margins. This projection from the source material it's just staggering. I mean, stop and think about your own patient load right now. Over 2/3 of adults living with multiple chronic conditions. This is way more than a healthcare cost. It's a huge hit to quality of life that we, as physios, are in a unique position to help with.
So how in the world do we tackle something that big? Well, this study gives us a beautifully simple framework, and it's built on just 3 pillars. I want you to think of them like the 3 legs of a wellness stool. If one leg is too short, the whole thing gets wobbly and unstable.
And those 3 pillars are sleep, physical activity, and nutrition, or SPAN. Now, as PTs, we are the undisputed experts in the P, physical activity. It's our bread and butter. But the huge idea here is that these 3 things are almost never studied, and maybe more importantly, they are almost never prescribed together as a single package.
And their connection? It's this powerful feedback loop. It's a vicious cycle, right? Bad sleep makes you crave junk food, and you feel way too tired to even think about exercising. A poor diet can totally wreck your sleep quality. These are not separate problems. They're one interconnected system, and that's the key. We have to start treating them like one.
Okay, so we know they're interconnected, but just how powerful is that connection? Well, the evidence for this comes from a massive landmark study by Stamatakis and his team, and they used data from the huge UK Biobank project.
And the methodology of this study is exactly what makes it so convincing. We're not talking about that fuzzy, self-reported data like, so how active were you last week? No. We are talking about nearly 60,000 people wearing accelerometers to objectively measure their sleep and their activity. This is high-quality, high-resolution data. It's a complete game changer.
Now check this out. This is where it gets really interesting. This visualizes the power of that synergy. Look at what it takes to gain 5 extra years of lifespan. If you just focus on physical activity alone, you'd need almost 12 minutes a day of moderate to vigorous activity. But when you combine it with better sleep and nutrition, that number drops to just 8.8 minutes. And look at sleep and diet. On their own, it's literally not even possible to get that 5-year gain. But together, it's totally achievable.
And here it is. This is the headline number. For patients who are in the best groups for all 3 of these SPAN behaviors, they can expect to get almost a full decade, 9.4 additional years of disease-free life. That's not just more years on the planet, it's more good years. That is a truly profound outcome.
Okay, that sounds amazing, right? But here's the best part. You don't have to be perfect to get these incredible benefits. And this brings us to the most practical, most actionable part of this whole thing, the idea of a minimum effective dose. Just how small of a change does it take to see a real, measurable benefit?
Prepared to be a little bit blown away. The researchers actually calculated the absolute minimum combined changes that were associated with adding 1 extra year of lifespan. And the inputs, they're almost shockingly small.
So, to add 1 extra year of lifespan,
The inputs are tiny. First, just 5 more minutes of sleep a day. That's it.
Then you add to that less than 2 minutes of extra moderate activity. I mean, that's literally just taking the stairs instead of the elevator one time. And finally, a tiny 5-point bump in diet quality. We're talking something as simple as adding half a serving of vegetables to one meal. You see, these are not massive, life-altering overhauls. They're micro-habits. And together, they are so potent.
Okay, this research is absolutely fascinating, but the real question is, how do we take this and translate it into our busy clinical practices? So let's bring it all home and build a framework you can literally use with your very next patient. Here's a simple 4-step approach. First, assess. Don't just ask about exercise, ask about their sleep and their nutrition. Second, identify the weakest link. For that specific patient, where's the lowest hanging fruit? What are they most open to changing? Third, prescribe small, combined goals. Maybe it's just 1 minute of brisk walking a day and adding a handful of spinach to their dinner. And finally, focus on synergy. The message is no longer you have to be perfect at exercise. The message is a little bit better across the board is incredibly powerful.
And the study's authors, they sum it up perfectly themselves. This is not about trying to create elite athletes or nutritional saints out of our patients. It's about leveraging small, combined, and genuinely achievable changes to create a powerful and feasible path toward a longer, healthier life for them.
So I'll leave you with this question. As you're thinking about your caseload for this week, who comes to mind? Which patient, maybe one who's been struggling to hit their physical activity goals, could really benefit from this synergistic approach? Think about that person, and think about how you might introduce the power of SPAN into their plan of care. Thanks for joining the Roundtable.